Hi, everyone. My name is Dr. Megan Yim. I'm a chiropractor here at VitaCare Natural Health Clinic, and I'm also here today to be an interviewer for our Beauty from the Inside Out series. Very exciting stuff. Tons of material here for you during this series. Now, how many of you out there are busy working, looking after your family, taking care of the house? The list goes on and on. And I find women in particular are very guilty of putting themselves and their own health at the very bottom of the priority list. But if you think about it, shouldn't you be taking care of yourself so that you can take care of others to the best of your ability? It just seems to make sense. So here today, I really want to focus on beauty, taking care of yourself, beauty from the inside out, feeling good and looking good so that you can be your best. Today, I'm speaking to an awesome naturopath, Dr. Katarine Holewa. Hopefully I pronounced that right. She has recently joined the VitaCare team after moving from her practice in Victoria. Dr. Holewa, very, very qualified, a little bit intimidating. She has a degree in cell and microbiome, a bachelor's in registered nursing. She worked in postpartum and the neonatal intensive care unit. Also worked while doing a 3-year traditional Chinese medicine program and a 4-year naturopathic medical training program. Wow, very impressive. She treats a range of patients of all ages, from patients with acne and mental health challenges, with allergies, all the way to chronic pain. She also has a special interest in working with gastrointestinal disorders, hormone rebalancing, and complex illness. But today, I'd love to focus on another of her specific interests, which is naturopathic aesthetics. So Dr. Holewa, can you elaborate and tell us what exactly is naturopathic aesthetics?
Hi, Megan. Thanks so much for the introduction. That was very generous. So naturopathic aesthetics is basically it's the application of naturopathic medicine to health and beauty of the skin. Aesthetics is skin health and beauty, and then a naturopathic goes along with that. We should clarify a little bit the difference between conventional and naturopathic medicine. So conventional or allopathic medicine focuses on health from more of a disease perspective. For example, it treats the disease or disorder using medicines that treat that disease or disorder. End of story. Alternatively, in naturopathic medicine, we approach health from the perspective that we have to treat the whole person because the person's many systems are interconnected. We see disease and dysfunction as not being sequestered in one part of the body or area, for example, the skin, but more that it's a condition that arises from an imbalance in the correct functioning of one or more areas, including liver health, hormones, digestion, nutrition. So for example, allopathic medicine says we treat the acne that this person has. Whereas in naturopathic medicine, we say we treat this person who has acne. It's a very different perspective and different way of treating. In terms of aesthetics in particular, aesthetics is just looking at skin health and beauty overall. People have been interested in beauty and skincare for years. It actually spurred the beginning of the aesthetics industry at the end of the 19th century. And it's just grown incrementally since then. It's now a major industry. Over the past couple of decades, we've started to see an interest in cleaner, more natural ways of living, and this has translated into the skin. So we answer the call with cleaner, pure, more highly effective treatments that support this changing view of health.
That's awesome. What originally got you interested in this field?
So my interest in aesthetics came about as a response to my patients. Over the past decade of my work, I've seen a growing clientele who list among their health problems dermatological or aesthetic concerns. So they tend to actually be a little bit more bothersome than something that might be bothering them, like an arthritis or whatever, because not only can they feel it, but they know that everyone else can see it. And so it bothers them more for that aspect. For example, for a woman who comes in with bloating and gas and abdominal discomfort, these are terrible, debilitating problems, but they really, she feels them inside. The acne on her chin and back are far more bothersome because she doesn't really want to wear a tank top and has to wear a lot of makeup to cover it up. But they're actually, they might actually have the same root cause. So we help with the digestive disturbance. We can often resolve the acne. I therefore realized that there's a really great importance that aesthetic plays in a person's self-esteem and therefore overall health. And so it's something I can help with on many sides.
Yeah, absolutely. That's great. So you mentioned acne a couple of times. Is that what you mainly treat with naturopathic aesthetics, or what other kinds of conditions do you treat?
Acne is just a very common example. But other areas of treatment that I see quite frequently are, for example, rosacea, hyperpigmentation or dark spots on the skin, which can be caused from some damage or hormone imbalances. I see a lot of textural irregularity problems like eczema, dandruff, psoriasis, and inflammatory conditions as well. This extends also into conditions of the scalp and facial hair. So people who have hair loss or excess hair growth. We also, in naturopathic medicine, and especially aesthetics, we tend to see a lot of people who are maybe not coming in for a particular concern, but they want to maintain the beauty and an external appearance that they have in the long term. They want to prevent getting wrinkles. They want to prevent getting sunspots or skin conditions from being in excess sun. So we can help with that as well.
Yeah, I know that's a big one for me. As soon as I hit about 32, I definitely noticed that sun coming in. Thanks for those answers. Another question here. So in determining kind of how you can help a patient, is there any sort of consult or maybe some testing that you would have to do?
Well, a naturopathic aesthetics intake follows a similar course to a regular consult, just with more of a focus on the skin, as opposed to, for example, hot flashes. So initial appointment, we identify and discuss the concerns that are affecting the individual and do a very, very thorough intake, including, digestion, supplementation, medication use, digestion, hormone imbalances, all of the things that could be pertinent to that one person. We definitely look to see if any testing would be relevant, and this could take the form of hormone imbalance, digestion testing, inflammatory conditions. There's several options, but we definitely look at if we need to do anything like that. And then we develop a treatment plan, and this could include some or all of nutritional or dietary recommendations, supplement recommendations, topical treatments. I use a very specific medical grade skincare line. We can look at talking about Botox or facial rejuvenation acupuncture, massage, lymphatic drainage, recommending colon hydrotherapy, and then any recommendations for further treatment or further testing.
Wow, that's a lot of tools in the toolbox. I have a couple of questions with the hormone testing. What does that look like?
I use a company called Precision Analytical, which uses a Dutch test. It's a urine hormone test. It's a dry
Okay.
And it looks at not only the sex hormones, estrogen, progesterone, testosterone, DHA, but all of their metabolites. So looking at how they're detoxified through the liver, and does a few organic acids as well.
Mm-hmm. Yeah, I know I'm a chiropractor, so I obviously don't do that testing, but I've had a couple of patients ask me, like, what would they look at? I've hit menopause already. Why do I need to get hormone testing? But it sounds like you do a lot more extensive work than just, a handful of hormones. Yeah, that's great. So you mentioned a couple of different aspects of where you would help skincare. Can you elaborate a little bit more on the role of diet in that treatment plan?
Yeah, so diet is critical. Everyone knows that diet's really important in health, but it's no less so important for the skin. There are many foods and food products that we consume that can either help or hinder the health of your skin. So, for example, foods that would hurt the skin or damaging tend to be things like, well, any personal sensitivities. So if you're sensitive to a food, it's causing inflammation in the body. This is going to come out through the skin. Alcohol, sugar and highly processed corn syrups, highly processed foods in general. Deep fried foods, of course, are terrible. And then non-organic dairy and animal products are typically more prone to causing inflammation because of a lot of the hormones and the products that are fed to these animals. And then on the opposite side, there are a lot of foods that can be very beneficial. And these would be the more anti-inflammatory, alkaline type of foods, things like, your fatty fish, dark leafy greens, eggs, flaxseed, berries, legumes, avocados, extra virgin olive oil. We're looking for healthy fats, healthy flavonoids, antioxidants, that kind of thing.
Okay. I know I've talked to a few people who've told me, dieting is really difficult, and that sounds like a pretty big list you're talking about. Would it start with like cold turkey, just taking everything out, or would it be more of an integrated kind of, let's try this versus this first? Like, what would that look like?
So I personalize my treatments a lot. So some people are keen to just jump right in and say, I'm taking that all out. A lot of people aren't. And so you take baby steps. Okay, so this week we're going to cut out this food, or once a week we're going to do it. It's like I said, it's very, very highly individualized depending on how determined a person is and what their resources are. If you're a working mom with kids and a ton of things on the go, you can't go cold turkey and just completely do everything. But if you have that at your disposal, then we can go there. Yeah.
Yeah. You mentioned a number of times inflammatory versus anti-inflammatory. Can you kind of just elaborate a little bit on why inflammation is so bad, particularly for the skin? Because I know it's talked about as this nefarious thing, but can we just elaborate a little bit on why?
Sure. So when we have inflammation in the body, specifically when it's coming from inflammatory foods, it's inflaming the digestive tract, which is creating a lot of antibodies in the system. And this comes out in the skin because the skin is one of our organs of detoxification. It's one of the most important ones. We sweat through our skin. And so when we're inflamed and we've got a lot of toxic elements in the system, these are all going to come out through the skin, whether that be as acne, which is really common, but also in advanced aging. So you'll find that people who have got more inflammatory conditions will have more wrinkles, more oily skin, drier skin. It comes out in that way. Yeah.
Interesting. That's really, really interesting. I'm definitely going to have to take a look at my diet too. So what other habits are really important for healthy skin?
Definitely, one of the big ones would be exercise. Exercise induces detoxification. Moving helps to circulate the blood and the lymph. You're a chiropractor, you know how important that is for us all. Sleep is so important. We sabotage ourselves so much on this one, but 7 to 9 hours is critical. Sleep is when our body heals and rejuvenates. When you don't get enough sleep on a regular basis, you see it. Bags under the eyes, dull complexion. Relaxation and stress reduction are really critical. Reading a good book, walking in the forest, it helps to decrease stress hormones, which are in themselves inflammatory, and then can set up imbalances in other hormones as well, including thyroid, sex hormones, etc. Fun, joy, laughing, happiness, trying to include those as often as possible. It releases endorphins, it calms the mind, it helps contribute to hormone balance. And then of course, getting out in the great outdoors, fresh air, circulation through the lungs also help to detoxify. I would say that's probably one of the more important ones. And I mean, nature is a natural stress reducer, anxiolytic, antidepressant.
Yeah, and we're so blessed here. Some of the best air quality in Nanaimo in particular, I believe. So you mentioned also that you have some supplements that you use as well as a specific skincare line. Can you tell us a little bit more about that?
Yeah, so the skincare line is called Illumia MD, and it is a professional medical grade skincare line with proven ingredients and proven results. It's got everything from your entire regular regimen of cleansing, toning, moisturizing, to specific serums which help with discoloration, acne, antioxidants, that kind of thing. And we just personalize a treatment plan using these and get very, very good results with them. In terms of supplements, it's highly individualized, but some of the more important ones that we would use include omega-3, 6, 7, 9s, probiotics if digestion is an issue, antioxidants, as I mentioned, and then some specifics. We could use mitochondrial support if that's an issue for a person, iron, histamine modulators, especially when there's allergies involved. And there's such a wide range, and it's such an individualized thing, which is why assessment is so important.
Yeah, I was definitely going to pipe up and say, man, you have to really know your patient and know their specific needs before you can even begin, I imagine.
Yeah, and that's one of the concerns with randomly going to a grocery store or a health food store and picking up things. They might work, but they might not be as specific to your individual needs, which then might mean they don't give you the results you're looking for.
Yeah, and you can end up wasting a lot of money too if you're buying expensive products that aren't really going to benefit you as well as others.
We got a lot.
Yeah, I know even friends of mine starting in our 20s, like slapping on all these different cleansing products and creams that really, I can't imagine they're doing us that much good long term.
Well, a lot of them also have got ingredients that I would consider quite worrisome, that you just buy over the counter. No specifics to mention right now, but it just bears being really careful that what you put on goes in.
Yeah. Yeah, I mean, the skin is quite absorptive, hey? So if you're putting on a product that has a lot of preservatives or fillers, I imagine that's not very beneficial. So I also heard you briefly mention, and again, this is becoming more and more on the radar, but you mentioned Botox. Can you tell us a little bit more about what you're doing with Botox?
So Botox is a treatment. It's a neuromodulator, and what that means is it's a treatment that just blocks nerve conduction very temporarily in certain muscles. That's helping to prevent lines and pulling from occurring in the skin. Botox has actually been used in North America, in the States especially, for over 50 years. It's highly proven, a very, very safe treatment. And like I said, what it does is it just stops certain muscles from doing what they're doing, so pulling certain areas in an effort to decrease the appearance of lines and wrinkles, specifically on the forehead, between the eyes, around the sides of the eyes, the crow's feet. And this can just help to relax the appearance and take away some of the grumpy lines.
I like that, the grumpy lines. Now, do you use straight up Botox, or do you use a derivative, or what do you use?
The product that we use at VitaCare here is called Nuceiva, and it is kind of a new kid on the block when we're talking about neuromodulators. It's a lot purer than the original Botox. It has less proteins added, so people tend to have less problems with it. Not that there are typically many problems with Botox, but it just they notice that it's just a cleaner effect. Nuceiva also starts to work a lot more quickly than Botox does, usually within about 3 days, and can last a lot longer. So that's the one that we use here at VitaCare that I've been using. Yeah.
Nice. And is it safe for anyone to get Botox?
Yeah, we do an assessment, of course, but to this date, there aren't any known side effects or problems with it, as long as you have someone who is a highly trained injector, because the biggest side effect is bruising or having it go into the wrong place. So if you have someone who's very skilled, highly trained, knows their anatomy, it's very safe. And in terms of just individuals, It used to be just kind of middle-aged women who are trying to stop wrinkles, but we're now starting to see that it has a very preventative effect when people start to use it a little younger. So when you can stop those lines from forming in the skin above the muscles, you can actually prevent some of that from forming later in time. Not only that, it's not only women getting Botox now, men are getting it. It's suitable for individuals of all genders and all ages over 20.
That's great. And then you also mentioned facial rejuvenating acupuncture. How does that work?
Traditional oriental and facial rejuvenation acupuncture are very similar in the fact that they both aim to restore the proper flow of qi, the circulating life force, according to traditional Chinese medicine, and blood through the meridians of the body. And a balanced qi reflects not only through the skin, but in particular in the face. It's a painless and gentle treatment. It's been used for thousands of years on individuals of all ages in Asia. And we're now starting to really see its benefits in North America. So facial rejuvenation acupuncture helps to minimize the appearance of fine lines, diminish the appearance of deeper wrinkles, lift drooping eyelids, and decrease the tendency towards drooping skin. It helps to reduce puffiness, helps treat acne and tighten pores, helps improve facial color, skin tone, hydration, and then overall it helps to decrease stress, improve energy and sleep, and promotes overall health and well-being. And acupuncture does this in general because it helps to increase local collagen production, helps improve muscle and skin tone, blood and lymph circulation, and toxin elimination and fluid retention.
Wow, I'm sold. Well, that was a lot of great information. If people are interested in getting a little bit more information from you, how would they go about contacting you?
So the best way is to contact VitaCare through our website, which we have information on the summit, and booking in an appointment to come and have a chat. We can, start small, start big, however you're ready. But yeah, I'm taking patients and happy to see you.
Okay, great. Well, thank you so much for your time. Really appreciate it.
Yeah, wonderful. Thanks so much.
All right, have a good one.
Have a great day.
Bye.
Bye-bye.